My name is Montreal Brooks, and I will be discussing sports nutrition affected by performance enhancement drinks. As we go through this, we will discuss the introduction, the procedures, and the methodology, and then conclude with our actual discussion questions. So, now let's proceed. Dealing with our main goal, we want to focus on what improves athletic performance through actual sports and nutrition. Here, we're going to look at a couple key factors. One being diet. How well a person's diet is established will allow them to have the performance they need to perform and excel in any type of sporting realm or even their average day. Next thing, we want to look at the actual hydration. Is a person hydrated? Are they able to have the necessary fluids to fight off cramping, to fight off electrolyte imbalance, and stay able to keep performing at their peak? Throughout the most recent trends, we've been able to see the introduction of innovative electro drinks. We have seen new drinks come on the market. We have seen new drinks come off. We have seen different type of sports drinks that are market, such as Celsius, such as Bang, such as all these different things that's supposed to give you a edge when you're actually in the weight room or playing sports. With the traditional approach, we all know that sports drinks such as Gatorade, which was established in the 1950s at the University of Florida, which basically was a carbohydrate mixed with electrolytes type of refueling procedure. Dealing in a humid climate, we was able to see that this allowed these athletes to keep pushing their performance without cramping up or losing a lot of electrolytes. Now, with that being said, we can look at the actual new approach, which is sugar-free drinks, which is MIDSs. This drink, unlike the predecessor, is mixed with amino acids. Amino acids are the essential building blocks that are built muscles and keeps the body going, such as anything from skin, hair, teeth, eyes, any type of, cell in the body. Amino acids are the building block. There are 20, but the fact of drinks are now incorporating this allows for a so-called better performance based experience. Now, with the current understanding, we know there's a limit knowledge of what affects on these various sporting drinks, such as how well does the performance level measure? How are we able to measure the electrolyte and balance? Is it balanced out between the water ratio and the electrolytes and the recovery process? Are we able to be able to go 3 rounds in a row as in a championship, or are we able to go 3 games back to back in a basketball tournament? We will see how these drinks measure up as far as the performance level. Throughout the research, there was a couple questions that presented themselves. Now, first being performance enhancement. Does a MIDS enhance the performance rather than any other sports drink or water being the basic, refueling for decades and centuries before? But what about in the 5K environment? The distance of 5,000 meters, 3.1 miles, typical standard high school distance running, and a track and field event and ladder. Also, how does the electrolyte balance work? Does this drink affect the blood electrolyte levels during exercise? Are these levels compromised? Are they affected? Are they enhanced? Maybe. We'll see. Next, we talk about cramp reduction. Can an MIDS reduce cramps? Is this amino acid blended electrolyte drink going to be able to slow cramps down or prevent them entirely? And the one thing that has been really presented in a lot of athletes lately is type 2 diabetes. How does the resistance training affect the walking speed and fasting blood levels of a type 2 diabetic? Is it good for them or is it not? With any science, we always have to figure out the insight of nutrition. And does it offer science-based guidance for athletes and professionals? Is this objective going to be, is this great? Is this not? Should we move on? Let's take a better look at it. The group I decided to use as far as my participations are basically 14 to 18-year-old high school cross country athletes. These athletes work more on a anaerobic base. So they're going to typically run 30 to 40 miles on any given week. Now, when it comes to making sure that we keep our variables, you know, constant, we want to look for no injuries, no past injuries or no current injuries. We're looking more of a group that's basically able to continue on and not stop the study. We want to check out their diet and see what kind of diets they're consuming. But this case is this high school population, so the modern Western diet is going to be in full effect. That could be various of other fast foods or other type of foods that Americans consume daily. Now, with the relevance of this study, we want to basically ensure that the study was very true to the current high school athlete, what the high school athlete eats and consumes. We wanted to make sure there was no difference of variations of public schools or private charter or prep schools, just basically your typical high school athlete and their food. We looked at their type of training requirements when it comes to cross country. This is a anaerobic mainly with some, sorry, this is aerobic mainly with a little anaerobic thrown in there once a week. Just basically, these are athletes are going to be able to have a lot of endurance, speed endurance, to be able to complete this course in time. There are variables we try to minimize, which is excluded any injured athletes to try to reduce any type of confining variables. We wanted to keep it straightly athletes that can participate. But as we know in the real world, there's always reflective typical diets such as veganism, such as people that have religious restrictions, and so on and so on. Now, when it comes to the size of our participants, we wanted to make sure our sample size was uniform. And we used 20 high school cross country athletes. Most teams in California or bigger states have up to 200. Most smaller states like Arkansas, Louisiana typically have, 20 to 40. So we wanted to keep it 20 just to be general across the board, but we wanted to make sure our instruments of measurements, such as the 5K run, was basically our standing testing for speed and endurance. Now, when we came to the outcomes, we found our true outcomes, basically being able to comprehend, what does an MDIS have on performance, electrolyte balance, and cramp reduction. And that's what we were able to come up with throughout this actual, study. We were also able to find out that the diabetic management, as far as like how well is does this, affect resistance training, benefit for a type two, athlete. So throughout the conclusion of this experiment, we was able to gain valuable perspective of sports nutrition. We were able to understand the fundamentals of what is needed for an athlete to be successful at this level, and the different type of nutritional basis that will go into performing, meeting their performance needs. The supported evidence was based on, enhancement and managing health conditions. A lot of athletes have pre-existing conditions, and we wanted to be able to address the actual facts of sports nutrition on these health conditions and better performance, just so that we can make sure that everything is documented. I wanted to put down the references used to help me conduct this study. On the next couple of slides, we can see that we have all the references included to allow you guys to go back